I will answer. I call on Government Order of the Day number 1.
Appropriation 2014-15 Confirmation and Validation Bill. Committee stage continued.
I declare the House in committee for further consideration of the Appropriation 2014-15 Confirmation and Validation Bill. Mr. Chairman. Mr. Chairman.
You have to.
Okay, Mr. Chair.
Hang on. The House is in committee for further consideration of the Appropriation 2014 and 15 Confirmation and Validation Bill. When the committee last considered the bill, it was debating the reports of committees relevant to the health sector. The Honourable Dr Jonathan Coleman had the call and has 1 minute 54 seconds remaining if he so wishes to.
Yeah, Mr. Chair. So to resume from where we were 2 years ago, look, if you look at the wider picture in health, over the last 7 years, this government has put an extra $4 billion into the health sector. And we've been very much focused on delivering increased access to services at the same time as globally most other governments in the Western world have actually been decreasing their public service spending, and their health services have been massively under pressure. So if you look at the achievements of this government in health, not only have we kept spending at about 6% of GDP, which is higher than that in Australia, but we've also been very focused on delivering those services which really matter to the people of New Zealand. So if you look at first specialist assessments, they've increased by 26% over that time. They've gone up from 430,000 to 540,000 per year. At the same time, we are delivering an extra 50,000 surgeries per year. So when we came into government, there were 118,000 elective surgeries performed each year. We're now doing 168,000 per year. And at the election, we pledged that we would continue to raise that at an average of 4,000 per year. And actually, we've exceeded that target. So very recently, we announced the first ever results of what happens to a referral when it goes from a general practitioner through to the hospital. And there's been a lot of debate around this area over time. And no government has ever traced that path. The only evidence we had was back in 2009. Pete Hodson, the Minister of Health, estimated that about 25% of patients were returned to their GP, and at that time that would have been 65,000. Well, we've looked, Mr. Chair, we've looked at the figures, and the first lot of preliminary data released last week shows that actually 87% of patients who are being referred by their GP to hospital services are getting an appointment. There's about 5% that don't meet the threshold, and there's 8% that have to be held for further information to be sought. So if you look at this area of unmet need, no government has ever been able to deliver every operation and every appointment that every person in New Zealand could benefit from. But the only answer in the end is to do more and more, and that's exactly what we've done. In the area of doctors and nurses, we've now got 5,500 more doctors and nurses working in the New Zealand health system than 8 years ago. So that's a considerable uplift in the numbers of personnel. But the other big challenge we've had, apart from increasing access to services, has been on the financial side. So when we came into government, district health boards were spending about $150 million more than they received in revenue each year. So they were in massive deficit, and the whole place was sliding out of control. Through a progressive approach, we have brought those deficits back to about 50 million, and we're determined to continue to reduce those. And if you take Southern DHB, where we have a commissioner in place out of the equation, those deficits are even lower. So the fiscal discipline does really matter. And the point I'd make is if you look at that whole picture of access to services and the change in the financial picture, it's only been a national government that's been able to increase access to services as well as manage the finances. And that's very important because we are never going to have an unending pool of finance for the health system. No one is ever going to say, stop sending dollars. It just won't happen. But what we do need to do is make the very best use of the finance that we do have in the health system. We've taken a very focused approach as well. So for the last 7 years now, we have had health targets for the sector, and that has given very clear direction to the system. So if you look at the system or the approach in ED departments, when we came into government, my local hospital, North Shore Hospital, there were ambulances queuing in the car park. That doesn't happen anymore because we set this target of everyone, of 95% being in and out of ED within 6 hours. And we've actually been very successful in reaching that target. We're no longer also sending people to Australia for cancer care. So when we came into government, 700 people had been sent to Australia for cancer care. We are also providing the elective surgery that people in this country need. The other thing that we've done is, for the first time, we have launched a comprehensive New Zealand health strategy which lays out the plan for the health system for the next 5 to 10 years and beyond. And actually what we need in terms of the health system, we need a change in approach whereby we're focusing more on the community, we're focusing on prevention and earlier intervention, because actually it doesn't really help the patients if the only point of intervention is once they get to hospital. We want to deal with things much, much earlier. We want to keep people well and in the community, deliver care closer to home, and all that has to be enabled with the best use of technology in the long term. If you look at the investment approach in justice, which my colleague Amy Adams was talking about earlier today, this government is very conscious that what we do in these different social sector portfolios, it's all linked. So in health, if we want to keep kids out of hospital, we've got to have well-insulated homes. That's 270,000 that have been insulated under the course of this government. If children are getting their immunisations, if they're staying out of hospital and staying well, they're actually going to do much better in the education system. If they come through the education system successfully with the skills that you need to actually function in a modern economy, they're actually going to have far better long-term social outcomes. So if you look at the statistics for people who end up in the justice system, they have fallen off the wagon at some point along the way. So all these things are interlinked, and what we do know from the political point of view is the health system is one of those things that the public really do care about, and this government has been very committed to making sure that health has been the largest beneficiary of new money at each budget, and I'm sure that will continue to be what happens into the future, because in the end we know that health, if well beyond the political arena, is one of those things. In fact, it is the most important thing that counts for New Zealanders, and we are determined to deliver on that.
The Honourable